Hello, my name is Isabel. I had a total TMJ joint replacement a month and 2 weeks ago, and 2 years ago I had lower jaw surgery. I wanted to share the essentials and the tips and tricks that helped me in my recovery.
As a disclaimer, these are all my own personal recommendations and things that helped me. Please direct any questions or concerns to your doctor and your surgical team. They know you and your case best.
So to start off at the hospital, you want to bring as little as possible. I left all my valuables at home, like my iPad. What I brought to the hospital was really just for comfort and day-to-day essentials.
For my hospital bag, I brought a backpack with a luggage ID tag attached to it. I packed contacts and glasses, eye drops, Aquaphor, a hairbrush and comb, and extra hair elastics, a nice zip-up hoodie, a phone charger, although I wasn't on my phone a lot, it's just nice to have as a backup. I brought pajamas, extra socks and underwear, slippers for leaving the hospital, and a neck pillow. And I made sure to bring 2 forms of ID and my healthcare card in a Ziploc bag with my information on it just in case it got lost. And I also brought any medications that were prescribed to me for post-op, although the hospital will have all the antibiotics and medications you'll need.
The hospital will take good care of you. They have the ice packs, they have the syringes, they have the water cups. Everything you'll need will be at the hospital. For sleeping at the hospital and when you get home, I definitely recommend a travel pillow, especially a memory foam one. This one is quite firm and it's able to snap shut, so just having it around my neck was really awesome for sleeping. I wasn't rolling around anywhere. This was $10 from Walmart. I know there are higher quality ones out there, but this one did the trick just fine. For the 2 nights in the hospital, I just slept in the hospital gown, and they also give you socks. But for leaving the hospital, I knew I wanted to be as comfortable as possible. So what I did was I packed pajamas that had the button-up shirt, so that way I wasn't pulling anything over my head. I also brought a zip-up hoodie and then slip-on shoes because I didn't want to bend down, tie any shoes. So just have stuff that's really easy to go and just slip on. I do highly recommend pajamas that you do not have to pull over your head and that just button up. So like I said, in the hospital, they provide you with the ice packs, but when you get home, you're gonna want a source of your own for ice and heat. What has helped me through both surgeries is this jaw sling. It's from Amazon. The brand is Lot Fancy, and you wrap it around your head and Velcros at the top. In the actual jaw strap, there are little slits and pockets to slide the ice packs in. Now, these ice packs can be frozen or heated, which I really recommend having something that can do both. This can go in the freezer or you can heat them up in the microwave, and they provide you so much relief. I ordered a second one off Amazon as well, and it's not necessary, but it was nice to have extra. So this reusable eye mask beanbag, this has been awesome for me. Just because your eyes get really dry and swollen, you can heat up in the microwave, you put it back into the eye mask, and it's just a nice way to relax and get a bit of relief. The other thing that helped provide relief were these crazy looking face masks that you can put in the fridge or the freezer to cool down. Really anything that's going to provide a soothing effect to your face is going to be beneficial. The other thing I purchased was this heatable beanbag. It's meant to go on your shoulders and your back, but I also used it to heat up and put on my feet. If I was a bit cold, throwing this on my cold feet, it was just a nice way to cuddle up in bed and just relax. The other thing I really recommend is purchasing a nice soft plush robe. You'll want to wear this forever, and also when you start sleeping on your side again, it's just really nice to have that cushion there because it is a bit uncomfortable where all the swelling and the scars are. So just having a robe that you can use as a blanket or as a legit robe, I really recommend. This microfiber hair towel was really helpful just because you don't want anything heavy weighing on your head or pulling your head back like a normal hair towel. I wear contacts and glasses and I have really bad eyesight, so not wearing either was not an option for me. I was worried about wearing glasses because of the incision that goes up and over your ear, right where the arm needs to sit of the glasses. What I did was I would wrap a clean piece of tissue or gauze around the arm and I would tape it. And then that way when you slide your glasses on, there's a cushion where the incisions are. It's clean and it's just a nice barrier for your incision, and then you can see. I was surprised that I could wear contacts as early as I did. Just use it by your own judgment. I was quite swollen and bruised under my eyes, so I would just play it by ear what days I would wear contacts and what days I would wear glasses. But your eyes will get very dry, so I really recommend a good quality eye drop. This one is the letter I dash drop eye drops. They're my favorite. So now my tips and tricks for oral care. For my first lower jaw surgery, all the incisions were done inside. So that meant they prescribed me a chlorhexidine rinse, and that's just a very strong antibacterial rinse. It's awesome. It will stain your teeth, but not permanently. All you need to do is go to a dental hygienist and they can scale and polish off that stain. It's just a little bit of like minor brown stain, especially if you have braces on. It'll gather around the brackets. That was in my experience, but it comes off easily from a professional cleaning. For the second surgery, the joint replacement, I did not have any braces on, so I had to be wired shut through 4 screws into my gum area, and I wanted to make sure I was keeping those areas clean. Even though you feel really delicate, I personally recommend cleaning it. I'd rather not have any further issues like cavities or infection in my mouth. So I really recommend a baby toothbrush. I think this is for like 2-year-olds. It's just a tiny little brush head with very soft bristles. It's very easy to get back into those areas. You won't be able to brush the inside of your teeth, of course, if you're wired shut, but just hold your cheek open, get in there and do a little bit of brushing. For flossing, you definitely won't be able to floss once you're unwired shut. I recommend these floss picks. There's some that are good for braces as well. Just very gentle ones, and that way you can get back there. It's too hard to floss with your limited opening with a normal floss. In the meanwhile, what I used were these little picks. They're soft bristled interdental gum picks, and they're wonderful. They really help disturb the plaque that's inside there. It's better than nothing. Even though I felt really sensitive and delicate, I knew that it was important to brush, but just do it within your limits. I think for the first 2 days, I did not brush my teeth. I couldn't even fathom that. I just remembered I did this in the early days when I was feeling like I couldn't brush my teeth at all. I would take a Q-tip and just try and clean my teeth. Very small, it's very easy to get in your mouth. And again, anything to disturb the plaque that's accumulating on your teeth is going to help in some form. I tried to rinse with water, salt water, and some mouthwash. Brushing your teeth with all those stitches and swelling and bruising and pain, it's no easy task. Do what's in your limits. Just try, see what you can do. Day by day, you'll get better at oral care. For sleeping, I know a lot of people invest in that wedge pillow. For me, I just slept with, I think, a total of 5 pillows that I stacked up behind me and beside me. Sleep sitting upright for at least 2 weeks. It's not as bad as it sounds as long as you're comfy with some blankets and good pillows. I also really slept better with white noise and a fan on. And then you're gonna go through spells of like hot flashes and cold flashes. So having a fan nearby when you do become hot, that's really helpful. Spend a lot of time in bed. What I did was I had this little cookie sheet, like a baking tray, and I used that as like a little breakfast in bed tray. That was really nice just to have something flat to keep any waters or medicine on. For wound care, I used one of those magnifying mirrors that you can flip and one side is more magnified than the other. That was really nice so I could see up close the wounds and like where I needed to clean more and care for more. What was helpful for my mom and I was having a whiteboard and some markers, and that way we could track the medicine and the timing of everything, just to keep organized and make sure you're not double dosing or missing a dose. Your lips will become very dry and very chapped. So what I used was Aquaphor and Vaseline. This Aquaphor I actually bought for my first surgery 2 years ago, and there's still so much left. So this will get you a long way. Make sure you have a good anti-nausea medication. I felt very nauseous, especially for the second surgery. What also helped was drinking room temperature water, not cold water, and also making sure I got fresh air at least twice a day, whether that was just cracking the window open or going for a little walk around the block. That will also help with your appetite. You will lose your appetite. Like, you're going through so much, and especially when you're on a liquid diet, it's not fun. You get sick of the protein drinks. So for me, going for a little walk, that really helped work my appetite up, and then I felt more inclined to eat things or drink things.
Here are 2 lists of foods that I enjoyed, one of liquids and one of soft foods. One of my favorite things when I was on the liquid diet was this frozen mango milkshake that my mom made for me. Once I could eat soft foods, this is what I also really enjoyed: steaming carrots, yams, or potatoes in an Instant Pot, mashing them up and serving them with sour cream. And these 5 things in the kitchen really helped us throughout recovery.
Eat what you can and what you feel like, but ice cream is awesome to have on hand. Add ice cream to anything. For that first week, I did nothing. I slept most of the day. I could really only have the attention span for short form video content. After the first week, you're gonna want to do hands-on activities like coloring, puzzles, baking. Making sure you have something to keep you entertained that's hands-on will be really good. I also recommend having some form of an easy read, whether that's a graphic novel or a magazine to flip through. Also, podcasts will be your lifesaver. The Office Ladies podcast got me through those sleepless nights. For everything else, such as wound care, exercise, physio, medication, definitely consult with your doctor because each surgeon has their preference of what they want their patients to use and do. So these were just the essentials that helped me with my recovery. That first week is going to be the hardest, so these things really made me more comfortable. It's not easy. I'm not going to sit here and say that it's easy, but there is another side to it. You will get through it. Just have the mentality day by day. It's not a linear perfect process. You'll have your ups and downs. You're not alone. So many people have gone through lower jaw surgery, and lots of people have recently been going through the double joint replacement of the TMJ. Well, good luck with any upcoming surgeries that you might have. I know it's scary and I know it seems hard, but we can do hard things. It is quite an amazing surgery if you think of it. Just know that I believe in you. If I can do it, you can do it. I hope this can help at least one person who feels a bit scared or unknown of their upcoming oral surgery. Please let me know if you have any questions down below. I do want to make more videos about my whole journey with idiopathic condylar resorption and my double TMJ joint replacement and my journey to get here. Thank you again for watching, and I hope you have a good day.